Let's start today with an update on how the pandemic is going in the United States and around the world. This is probably the least good update that we've had in a couple of months, but it does require some thought and some explanation, and there's some details to understand. So the top line, like the bad number, the number going in the wrong direction, is cases. Cases per day in the United States and around the world are now climbing once again. And after more than 2 months of declines, and significant declines for much of that 2.5 month period, average daily cases are again ticking up, not by that much, but from a low of about 55,000 new cases a day in the United States, now up about 5% to 58,000 cases per day. Remember, context, these are numbers many in 2020 thought we would never get to. We blew past them all the way up to 255,000 cases per day, came back down, and now we're back up from 55,000 to 58,000. What is driving this? We're vaccinating. We're vaccinating millions per day at this point, and we'll look at those numbers. How is it that cases are again going up? Couple of different things going on. One is that in some states, the more contagious British variant known as B.1.1.7 is becoming more widespread. Now, remember that the vaccines work really well against B.1.1.7, but among unvaccinated people, it's going to spread more. That's exactly what is happening, for example, in Michigan. Michigan is a place where B.1.1.7 is becoming more widespread as the variant of dominance. And Michigan's cases aren't just ticking up slightly, they're skyrocketing, primarily, again, among unvaccinated people. Michigan cases are up 250% from a recent low. So the other aspect of this is more of a sort of, I guess you'd call it a psychological aspect in a sense. As people learn about vaccination and they hear that people are getting vaccinated and they hear that cases are coming down, some people choose to behave less safely. And there's an analogy here to something that traffic engineers deal with. When traffic engineers look at a stretch of highway or road, for example, that has a lot of traffic, and they say, we need more lanes in order to better accommodate traffic, they will start a project to widen a road. And of course, people learn about the fact that the road is going to be widened and will have more capacity. And often what happens is that by the time that the road is widened, increasing capacity, more people, because they have heard, hey, this road will have more capacity, so traffic will go down, more people choose to use the road. And so by the time that the road is done, you have more capacity, but traffic is moving just as slowly because more people are choosing to use the road. Similarly, we are seeing spring breakers in Florida, states rolling back all guidelines, et cetera, as cases started to come down because vaccination was going up and the seasonality effect. More people are behaving less responsibly, less safely, I guess we would say. And thus we are starting to see cases tick back up. Now, despite cases going up, the good news is that deaths continue to decline for now. As we know at this point, deaths lag cases by about 3 weeks. We're already 3 weeks out from cases leveling. Deaths continue to decline from their peak of about nearly 3,500 a day towards the middle to end of January, now down to about 1,000 deaths a day. That is a decline of 70%, but the rate of decline is slowing down. And one signal that might not bode so well is in terms of people going into the hospital. New hospitalizations have also continued down, but the rate of decline is slowing down significantly. So this is a crucial period of about, I would say 2 to 3 months is what most of the epidemiologists say. It's a battle of vaccination versus variants. And we have very good data about how good the vaccines are. I read yesterday a study which tracked California healthcare workers after being vaccinated. And what the study found was that the fully vaccinated healthcare workers, meaning 14 days out from dose number 2, something like 0.05% became infected. This is a group that's highly exposed, working in healthcare settings around unvaccinated, sick patients. Very low rate of contagion among those who are vaccinated. So that's the good news. Vaccinations now averaging right around 2.5 million doses per day. That's a combination of 2-dose vaccines and single-dose Johnson and Johnson. Total 2.5 million doses per day. That number should continue to grow. It appears that it is going to continue to grow, but this is not a good time to start going crazy the way we've seen spring breakers do in Florida. So super zoomed out, vaccinations up, deaths down. That's good. Medium term, hospitalizations leveling out, not declining that quickly lately, cases up, and vaccine distribution in much of the world not good. And ultimately, I mean, to really get back to normal as a global village, for lack of a better term, other countries are going to need to do well on vaccination. There are countries not expected to get significant access to vaccines until 2023, maybe wouldn't even fully vaccinate until 2024. Who knows what variants we'll be on to by then. So this is a bigger issue. Now we're starting to hear, more about vaccine equity and countries like the US and the UK hoarding vaccines and different issues. As I've said before, I think it's perfectly natural that countries would try to vaccinate their own people first. But there is no question that until there is more vaccine distribution globally, we are not going to be able to say that we have dealt with the pandemic. But let's keep vaccinating. All you can do here in the US is when you can get a vaccine, get one. That's what you can do. One of our sponsors is Monk Pack. It's tough to get excited about most granola bars. They have a lot of carbs. They don't taste that great. They don't really satisfy your cravings. But Monk Pack has something totally different. Monk Pack Keto granola bars are sweet and delicious with a soft and chewy texture, only 140 calories, 1 gram of sugar, and only 2 to 3 net carbs, which make them work perfectly for the keto or low carb lifestyles. They come in excellent flavors like coconut cocoa chip, honey nut, blueberry almond vanilla. That's my new favorite. I love these because you can just grab them anytime. Maybe it's a quick breakfast, an afternoon snack when you're busy. Forget the dry, bland granola bars you've had in the past. Try out Monk Pack Keto granola bars. If you don't love them like I do, they'll give you all of your money back. You'll get 20% off when you go to monkpack.com and use the coupon code Pakman. The link is underneath this video.